What if the technique you've been using for 40 years is now silently working against your health? Most older men never get told how to adapt. They just continue doing what always felt familiar, faster, firmer, focused only on the end goal. But here's the truth. After 60, your body changes. And if you don't change with it, what once brought you comfort can now lead to frustration, discomfort, and even long-term harm. Because the wrong technique, if repeated for years, can damage circulation, reduce nerve sensitivity, and quietly chip away at your confidence more than you realize. That's what we're fixing today. I'm Dr. Emma Blake, your trusted men's health advisor. Here's what we're covering today. First, why self-touch suddenly feels different after 60, and the 3 major body systems that shift. Then, the 5 silent mistakes older men make during self-touch that damage circulation and nerve sensitivity. And finally, the complete, healthier routine that protects your health and supports your comfort for years to come. The technique at the end only works because of what I'm about to explain right now, so pay attention to this next part. Hit that subscribe button because what we're covering today is based on male physiology, aging biology, and 7 years of clinical experience helping men navigate these exact changes. Let's start with a question many men don't want to ask. Why does self-touch suddenly feel different after 60? So many men come into my office convinced something must be wrong with them because things don't feel the same. They'll say, "Doc, I used to finish in 5 minutes. Now it takes forever." Or, "I feel less sensitive. Am I broken?" Or even, "Do I still have a healthy sex drive, or am I losing it completely?" Now, here's where it gets interesting. Here's the myth. Aging equals dysfunction. The truth? Aging equals adaptation. Your body isn't betraying you, it's simply changing. And what worked at 25 won't necessarily work at 65. That doesn't mean pleasure is gone, it just means the path looks different. And sadly, most men were never taught how to adapt. Instead, they double down. They grip harder, move faster, and push for climax. And all that does is create more tension, irritation, and disappointment. Let me explain the science of what's actually happening. After 60, 3 major systems shift. First, hormones. Testosterone gradually declines. That doesn't erase desire, but it often makes it less spontaneous. You may not feel those automatic urges you once had, and that's normal. Second, blood flow. The small vessels that supply the penis become less elastic. Erections may build more slowly or fade if you feel distracted or pressured. And third, nerve sensitivity. Nerve endings don't fire as quickly. Touch that once sparked instantly may now feel muted or take longer to register. But wait, there's something else happening here that most men don't realize. Biologically, that's the landscape. Emotionally, it can feel confusing, like your body has changed the rules without telling you. Practically, it means the old routines often don't work the way they used to. But here's the encouraging news. With the right adjustments, many men find not only relief, but deeper satisfaction than before. So let's go through it. The 5 silent mistakes older men make during self-touch and how to fix each one. Mistake number 1, using the same grip strength you always have. When you were younger, a firm grip may have been fine. But after 60, the skin of the penis is thinner and more sensitive. A too tight grip can damage small blood vessels, reduce blood flow, and actually desensitize nerves over time. And this is where it gets critical. Biologically, microtrauma builds up, and your body adapts by dulling sensation. Emotionally, this leads men to think they've lost feeling. Practically, over years, you may find it harder to respond to a partner's touch, which can impact confidence. The fix: loosen your grip. Experiment with gentler holds. Focus on sensation, not force. Mistake number 2, going too fast, too soon. Your nervous system processes stimulation more slowly as you age. Rapid motion can actually overwhelm the signals, leaving you feeling flat or unsatisfied. Think of it like tuning an old radio. You have to slow down to hear the music clearly. Here's what most people don't realize. Biologically, slower rhythmic stimulation allows nerves and the brain to catch up. Emotionally, you'll feel more connected to the experience instead of frustrated. Practically, build momentum gradually. Don't rush to the finish line. Mistake number 3, skipping lubrication. Too many men think lubricant is optional or only for women. But as testosterone decreases, natural lubrication drops in men too. Combine that with thinner skin, and dry stimulation creates friction that can cause micro tears, rashes, or soreness the next day. Keep this in mind because it connects directly to protecting fragile tissue. Biologically, lube protects fragile skin and improves nerve response. Emotionally, it turns discomfort into pleasure. Practically, keep a simple, unscented, water-based lube nearby and use it early, not as an afterthought. Mistake number 4, forcing climax. So many men treat climax like a pass or fail test, but after 60, arousal may come in waves. Sometimes climax takes longer, sometimes it doesn't happen, and that's not a failure. When you push, your body releases stress hormones that actually make climax harder to reach. Let me clear up a massive misunderstanding about this. Biologically, stress hormones compete with arousal signals. Emotionally, pressure leads to disappointment, even shame. Practically, redefine success. Satisfaction doesn't have to mean climax every single time. Mistake number 5, ignoring your body's signals. After decades of routine, many men go on autopilot. But at this stage of life, your body's feedback is crucial. If something feels dull, adjust. If something feels uncomfortable, stop. If something feels unexpectedly good, stay with it. Remember this because we'll come back to it. Biologically, this keeps nerves and circulation responsive. Emotionally, it builds trust between you and your body. Practically, shift from performing to exploring. So what does a healthier self-touch routine look like after 60? Let me walk you through it. First, choose your moment. Don't rush. Give yourself 15 to 20 minutes of privacy. Your nervous system needs calm, not pressure. Second, set the environment. Soft lighting, comfortable posture, even quiet music can help your brain relax into the experience. Third, start with breath. 5 deep, slow breaths before touching anything signals to your body, I'm safe, I'm present. Fourth, apply lubrication early, not as a tool for finishing, but as part of the beginning. Let it soften and warm the tissue. Fifth, explore slowly. Think of it as a massage. Use different pressures, angles, and rhythms. Don't race straight to the most sensitive spot. Sixth, pause when needed. If arousal fades, it's okay. Let it return naturally. Seventh, stay with your breath. Breath keeps blood flowing, nerves alive, and your mind anchored. Even your position matters. Sitting hunched forward on a hard chair can compress pelvic nerves. Instead, try reclining, lying on your side, or propping your legs with a pillow. And don't be afraid of using tools. Warming sleeves, textured aids. These aren't toys in the childish sense. They're tools, just like reading glasses, designed to support a changing body. Now let's talk about something just as important: when to check in with a doctor. Because while most changes are natural, some are signals your body needs medical attention. Here are 4 clear signs to watch for. First, persistent pain or burning during or after self-touch. This could signal inflammation or a minor infection. Second, sudden or ongoing numbness. Gradual change is normal. A sharp drop in sensation may mean nerve involvement. Third, difficulty achieving erections even in private, relaxed settings. That may point to vascular or hormonal issues. Fourth, emotional distress. If shame, frustration, or anxiety are overwhelming your experience, it's worth talking through. Talking to a urologist doesn't mean weakness. It means you're invested in your well-being. Even a short visit can give clarity and relief. And remember, you don't need to wait for a crisis. Preventive conversations are part of good health. Here's the bottom line. Self-touch after 60 is not about forcing your body to behave like it did at 25. It's about adapting with respect. When you loosen your grip, when you slow your pace and build momentum gradually, And when you use lubrication early and redefine success beyond just climax, you're protecting circulation, preserving nerve sensitivity, and maintaining confidence. Try this approach starting today. Give yourself 15 to 20 minutes of calm privacy. Start with 5 deep breaths. Apply water-based lube early. Explore slowly with different pressures and angles. Pause when arousal fades and let it return naturally. Stay with your breath throughout. Watch for more mindful, meaningful pleasure instead of rushing to finish. That's when you know it's working. If this completely changed how you think about self-touch after 60, hit that subscribe button. Drop a comment and tell me, where in the world are you watching from? I love seeing this community stretch across the world. Thanks for watching. Keep learning, keep growing, and keep taking care of yourself.